So toddlers. Toddlers are probably my favorite of all the groups of children. They're probably the most difficult, probably the hardest to work with. They're that terrible too, right? I think Jerry Seinfeld said it perfectly that having a 2-year-old is like having a blender without a lid, and you turn it on and they're up, out, and they're everywhere all at once. It's hard to keep up with them. Intense period of environmental exploration. This is temper tantrums. This is obstinacy, negativism. Me, mine, I do. No, no, no. That's a toddler. As a toddler now, we have gained a lot of weight, right? We have tripled our birth weight by 1 year old. It takes now up to 2.5 years old to quadruple it. So you could see we slow way, way down. It takes another year and a half to get there. The height is slower. Our legs are getting longer now. Our head circumference, we know there's no problem. The head and the chest are the same, or even the chest is bigger. And by age 2, you are half your adult height. As we are toddlers, our body systems are getting more mature. That's why we're going to do that potty training, right? The upper respiratory infections, otitis media, tonsillitis, everything here, right? Big, big, big problems with chronically being sick. The reason why, well, what do toddlers do? They play all day long. And what do? Is they put everything in their mouth. So many of these children are in daycare with other children, and they take a toy and it goes from kid to kid to kid, and they're swapping spit from this child to this child, and that's spreading the disease. Now, is it a bad thing? Well, to an extent, you don't want it to be too much going on with these multiple infections, but it's actually good because the body is now making antibodies and antigens against these diseases so that in the future they're not going to be as sick because their body now can fight it off by themselves, right? But it's still a lot of sickness as a toddler. Gross and fine motor skills. We're going to start seeing some refinement of them about ages 2 to 3. And by 12 to 15 months, now we're doing both hands. Are they right-handed? Are they left-handed? Who knows yet, right? And we're throwing a ball by about a year and a half. Our vision is really pretty decent. And then that depth perception I was talking about, where the binocularity in the eyes is getting a lot better. It does have a little bit of problems because they're wanting to do things. They have not complete depth perception. And then, of course, their motor is still awkward. It's not as refined as it should be. So this is the child that's going to be trying to climb. This is a child that's going to fall. This is a child that I've actually had in my ear who's climbed up the front of a chest of drawers to get to the TV that was on top, and the whole TV and drawers fell on them. So yes, this is something they do. Something about toddlers is when they become toddlers, we're feeding them, quote, table foods. Their taste has starting to get really developing, and they really become these picky eaters. There are certain textures, smells, colors, all things that children, they just won't eat it. You've got some toddlers, and I know my grandson was, the top of the list. He only wanted chicken nuggets, macaroni and cheese, French fries, and apple juice. I mean, that was, of course, that would always go into them. Of course, you've got to feed them all the foods, but that picky eater is just absolutely normal. But they're not growing that much now. Everything's slowed down. So whereas it looks like they're not eating enough, there actually are. Now, let's go into the theorists. Let's talk about psychosocial. Psychosocial is the society around them, right? Dealing with people. How do toddlers deal with people? Well, Erickson says it's autonomy versus shame and doubt. What does this mean? Well, autonomy. automatically mean mine. It's mine. I'm not sharing. Me do. Get away. Wah! I'm going to do it, right? Falling on the floor, temper tantrum. But what is the shame and doubt? Shame and doubt is that mother or grandmother or whatever who's like that helicopter mom who's right behind these children and not letting them do anything by themselves for fear that they're going to fall or they're going to hurt themselves or pinch their finger or not put on the shoe correctly or the shirt's going to be on backwards inside out. That's shame and doubt. So Erickson says this child wants to do it all by themselves. Automatically me, mine, okay? And the shame and doubt is shame on you, mommy and daddy. Let the child do things and let them make mistakes because that's how they learn. And we know toddlers' favorite word is no. No. It's always what they say. How do we provide any sort of comfort support for these children, especially in a hospital setting, which is completely scaring to them? This is where we have to have their rituals, which means what's their routine at home? I think the biggest one that we talk about is bath time routine. I mean, some children wake up in the morning, take a bath, and get on with their day. Other children do it in the afternoon. Some do it right before bedtime. But that bath time is usually the one that child is functioning with. To change that might upset this child a lot, especially if you're a toddler who has a congenital problem like Down syndrome. You cannot change that bath time or that ritualization. That child wants to know when he gets up that he's going to do his normal thing. Is it eat breakfast, then go change in his clothes, brush his teeth, play his toys, go outside? What does he do? He needs to do something there similar. Also, trying to keep the food that eats about the same. That can help too, if you can with a diet. So cognitively, so the first 2 years, it's all about that sensory motor. That's all about in the mouth. That is what does it feel like? And this is all about, playing, right? And learning and being magical. Again, it's also that object permanence. I know that even if I can't see it, I know it's still there. As they get a little older, so that up to 3, they're starting to use things to pretend play. Good example, a broom is now a horsey. My arm's out, I'm now an airplane, okay? This is what they can do. Thinking at this age, you're getting more creative here. This is some examples to show you about the ages and how they learn. I mean, they learned where their finger was. Now they got it. They learned the rattle shakes. They like it. And I like the 12 to 18 months tertiary, where the baby accidentally one time hit off a sippy cup off the high chair. And mom comes running because she was in the kitchen fixing the rest of dinner for everybody, right? And the baby was there alone eating. And the baby hit that, and mommy come running over to get it for him. Oh, they realized every time they knock that cup off, mommy's going to come back running over. So it becomes how many times can I hit it over? Mommy will continue to come before she takes it away, right? So again, autonomy versus shame and doubt. Just know that toddlers don't have any sort of ego yet. They don't know right and wrong yet. They're more of an id. They do what they want. They don't understand there's consequences there. We know that their behaviors are that no, me, mine. And of course, we know giving them a sense of routine keeps them where they need to be. As the toddlers start to see that there's differences, mommy, daddy, well, we're doing potty training, so that becomes part of it. They do touch themselves. It's how a parent reacts to it. As in, if they're in public, say, take your hand out of your pants, you're in public. Or are you itching? You have a problem? Or go to the bathroom if that's bothering you. Again, treating it, like it's not a big, horrible thing that they do have their own private part. We know that you'll find sometimes kids playing with themselves, and that's normal. Just break them up and get them off and distract them out. We know that part of toddlers is understanding that they have things that will calm them. Now, it's all me, mine. I'm going to do it. But let's say you want to put that child to sleep. That child's not going to go to sleep unless they have his special blankie and his special little, stuffed animal of sort, right? So those transitional objects are a big thing. Toddlers are now talking. After 1 year, it's a one-word sentence. 2 years, it's multi-words. We know that they are starting to become more independent. They want to be. They don't want people doing it for them anymore. Feeding, playing, dressing, and undressing. They're extremely, strong-willed here, and they want to do what they want to do. They're starting to understand others' feelings. Starting. Play. Play with toddlers is important. It's what they do. This is how they learn, how they interact. Does it mean they interact with other people when they play? Toddlers notoriously don't want to share. They want to play by themselves with their toys. They participate with other children next to them playing, called parallel play. You need to understand toddlers play is parallel play. Parallel play is they're playing next to each other and they're not sharing. Okay. Potty training, toilet training means you need to have those signs that they're ready to potty train. Part of it is, and it's, if you look at the notes on the page here, it's written there for you if you want to know exactly the three. But basically, they're starting to have their diaper, they keep it drier for more than 2 hours. Oh, and bowel training is definitely before bladder. They can feel the stool there. They can control that more than they control their urine. We know sibling rivalry will always be there, younger, older. Temper tantrums, this is toddlers. This is what they do. Probably the hardest time is bedtime. They don't want to lose or miss anything, so they don't want to go to bed. So it's usually when they have their moments. Again, negativism. No, no, mine, me, do, leave me alone. And we know when a toddler and small children get upset, how do they deal with stress? They basically regress. They go back to those old habits, sucking the thumb, the finger, or maybe, the blanket and holding it a certain way or whatever. But this is part of toddlers. And remember, timeout is what we do for this age. 1 minute per year of age. So if you're 2 years old, it's a 2-minute timeout. Um, Basically telling the child what they did wrong, they need to be quiet, and then the timeout will start. As I said, toddlers are basically anorexic. They don't eat much, and parents get upset with it. But as long as they are cognitively aware, they are gaining weight the way they should, it's all right. The one thing that has to be a big concern is if you have any sort of specialty diets, like if you're vegetarian, making sure that this child's getting enough protein. Why do you want enough protein? Protein aids with wound healing, doesn't it? So if you don't have enough protein, you're not going to heal. If you're in there for surgery, that's a big deal. What if you had a problem, that you can't have milk, right? So if you're lactose intolerant, you still need calcium, you still need vitamin D. It needs to be given in a different way. So that's what I was talking about with toddlers and talking about their anorexia. And they are poor eaters, but there are some concerns, and those things we have to be aware of and fit into their diet. Dental health. At 6 years old is when all the baby teeth start falling out. And then by The end of school age is when they get all of their permanent teeth are in. So toddlers, we know that the big thing is flushing them with fluoride and flossing. They say children under age 6, they don't have the dexterity to floss, that parents need to help, but flossing is encouraged after age 6. Taking things, ingesting things. The one that the book talked about a lot was lead poisoning. Lead poisoning, most of the time I've seen, is due to old buildings that have lead-based paint. And then you're talking about a toddler. How does a toddler get lead-based paint into their system? Well, think about a toddler standing next to a window in a windowsill, and they're up against the window waiting for mommy and daddy to come home. They're sitting there, they like things in their mouth. What are they doing? They're chewing on that windowsill with the paint, and they're getting chips in their mouth. And this possibly could be one of the ways that they get lead poisoning. Now, how do you treat lead poisoning? Well, they're going to be presenting with nausea and vomiting, maybe seizures. It's a very serious thing. So we can do two things. We can give medication. It's an iron chelation medicine called Desferal, or we can do something called chelation therapy. And that's a machine. It looks like dialysis, but it's an apheresis machine, and it only pulls off iron. So all the other components of the body is left there, but it pulls off what you don't want, which is the iron. Most common ingested poison are, medications, etc. In my career, I have seen more ingestions of Flintstones multivitamins, probably the biggest of all. Although I've seen grandma's, digoxin, I've seen rat poison, of course, those Tide Pods, we've seen those when that brave was going around. Again, if we have a parent who's asking you about concerns about their child, if they ever ingest anything, what is the treatment? Number one, call poison control. Don't get in the car and run to the ER. Immediately call poison control. Because if there's initial treatment we can do, it might be just drinking a glass of milk, who knows? But we will never tell them to vomit. But again, we can get the most up-to-date information. Another thing, because I've worked very closely with poison control, is they call back and follow up with their patients to find out what's going on. And they have the most up-to-date stuff. Safety promotion will always be motor vehicle. And then, of course, water safety, and of course, burns, falling, et cetera, during toddlers. Putting a car seat in, remember, up to age 2 is rear facing, then turn it around, knowing that shoulder straps to fit snugly. You could put nice blankets in there to roll and prop them in there. And they do say to put it in this back, believe it or not, of the center seat. There's some questions to look at you for your reflexes. And now preschoolers. Difference between toddlers, preschoolers. They're almost the same, but they're getting not as awkward. They're getting more limber. They are getting more vocal, and they have more words, and they're getting more patient, and you'll be able to sit down and pay attention for longer periods of time. As I said, the growth is about slow as toddlers. Again, as long as it's moving forward, doing good. Children in preschoolers, if you start seeing them getting like belly pains, tummy pains, or they never had that before, this is way sometimes they show you they're in stress. Gross motor skills, walking, running, climbing, and jumping. They're doing hopscotch. They are jump rope, throwing the balls. Fine motor, we're talking eye, hand, muscle, dressing, drawing, cutting with scissors. Preschoolers in Erickson. Erickson talks about initiative. It means that they want to do things, but they only know their way. And sometimes it's different than what they expected. And that gives them, you know, anxiety. It doesn't feel good. They feel guilt, anxiety, fear, because they're not thinking the way that the other people thought. That's just Erickson, just knowing initiative. And we know this is when morality starts as preschoolers. And what do they know with morality? They know reward and punishment. There's consequences for good and bad behavior. Cognitively, we're getting them ready for school. Parents should read to them. They should be in activities that have other children so they can get along with other kids. We know that their language is getting more. We know that they are understanding time, but it's not the way you think. It's not a clock. It is after lunch, we'll be going to see grandma. When you wake up in the morning, when the sun comes up, we're going to Disney. When the sun goes down, the movies coming on TV. It is, they understand time because of events. They don't understand in the afternoon, 2 o'clock in the afternoon. They don't get that. All right. And if you ever listen to a little preschooler play, these children are talking magical and they're making up their own little things, their own scenarios. As I said, Kohlberg is right and wrong and a consequence, which is reward and punishment. Preschoolers are children that have a problem if they get a boo-boo. As to this day, my 9-year-old, it's almost 9, comes in and says, Nana, I got blood. I'm blooding here. And it's, this little piece of blood, no big deal. So I said, go get the Band-Aids. So part of preschoolers is feeling that if their body is broken open, a scratch, bleeding's coming out, that their insides are all going to fall out. They feel this. They fear things like needles, etc. So this is a child that you really have to inform and help them understand what you're doing so they can help you. Spirituality is what the families taught them. They don't know any other stuff yet. They only understand, the family. They're not into other families and the friends of families and other religions and other ways to use their spirituality. So, sexuality. Preschoolers understand that girls and boys, the roles that they do normally, okay? Girls like their daddies and boys like their mommies. It's just one of those things. And again, preschoolers, they are exploring themselves and masturbation becomes a thing. They also are becoming more modest, as in they won't walk around after the bath without covering themselves quickly, whereas before they'd run around the house naked and didn't care. Stranger anxiety, separation, all that stuff is they don't have that much anymore. Again, those security is derived from familiar objects. That's when they have that special something. I was telling my other class, my grandson had a little beanie baby, and it was the shape of a giraffe. And we called this little guy Mr. Puppy. And if he had Mr. Puppy, nobody could hurt him. So, yes, these are things that you use to help them through these difficult times, especially the hospital. And of course, play therapy is just tell me what's going on. How can I help you with these fears? And it's a great tool to use. Language is more complex now. Another thing, their language, they're starting to become more making words up, teleportation, teletransportation used to be the words that I used to hear from my grandson. It was a word that he used and it didn't make sense the way he used it, but it was a big word. So it's part of what they do. We know preschoolers dress themselves, they do want to please, but they are going to test you. They're going to try to get as much as they can, like delaying bedtime, those sort of things. They don't need as much of that rituals and that routine like toddlers do. The play on a preschooler is associative play. Two or more children playing together, no goal. They just play and they have fun. And then dramatic play, we would be using that if there was a bad situation, let's say in a hospital, and we're trying to reenact it to find out what happened. And usually, child life or a psychologist might do that. As I said, sex education should be given because they're starting to understand it. They have different body parts. They'll make sure that it's normal. They do recommend using correct anatomic words. So, family choice. As I said, fears are being in dark, being alone. They don't like big dogs and ghosts, and they don't like people or objects associated with pain. So they don't like me because we are the ones with the blood pressure cuff and the IV and the needles, right? We know that there's speech problems somewhere between 2 to 4 years of age, and we know early intervention can help with that. Sleep, they do get sleep. This is a time, sometimes they do get night terrors. Again, it's trying to put a good nighttime routine that slow down, that's stopping the drinking before they go to bed, etc. And that does help. Safety education will always be huge. What do you teach a preschooler? Well, preschoolers are now more active, more mobile. These children have increased pedestrian motor vehicle accidents, as in they're being run over, run into. I've seen 3 children ran over. So, a good outcome, a bad outcome, and one that went through a lot of recuperation. So, again, preschoolers need to be taught about safety and cars, using protective equipment, helmets, etc. As they get on to school, know that they are going to start to get friends, same-sex peers. Again, now we're getting to understanding other people. We are into spreading diseases, which is part of it. There are some questions regarding your chickenpox. Know that varicella chickenpox is a airborne disease, and it's something that these children must be kept home out of school until they all dried up and crusty. Conjunctivitis. This is when the eyes get all with infection. Again, washing hands is things that we're going to teach. Putting the medicine in, and then remember if it's that blurry medicine, the ointment, let that child know. And then, of course, mouth sores. Again, that's a lot of pain relief, and again, washing hands. Intestinal parasites, worms, knowing to wash hands, knowing to keep their nails short so that we're not getting eggs from outside into their mouths underneath their nails and then putting this through the house. And then child maltreatment, child neglect could be physical, emotional, psychological. Again, our job is to protect the child. When you see differences in what you see and what they're telling you happened, put the red flag up. It's better to be safe than sorry. We talked about moose housing already as we did that slide. Again, it's somebody trying to hurt a child. And again, our job is to protect that child. One of the things that we forget is some of this child abuse, maltreatment that we see wasn't the person who brought the kid in to the ER or doctor's office. Remember, if it's their child, they're suffering. Remember that parent needs help too. So parents tell the nurse that their 3-year-old daughter and a male cousin of the same age have been inspecting each other closely as they use the bathroom. Which of the following is the most appropriate response by the nurse? Anybody?
B. B.
Absolutely. You don't
B.
condone it, you don't condemn it. you just say, oh, come on, let's go get a snack, let's wash our hands. It's something that if you bring attention to it, it's something that can, you know, hurt them psychologically, and we don't want to do that. We want them good and healthy. So we have one more Kahoot, and then we're done. Who wants to win this Kahoot? Let's get out of there. Let's go to here. Sorry. All right, let's get going. Toddlers and preschoolers. There's some slight differences and some similarities. Types of play considered to be sense pleasure play. Remember, sensory motor, sense is part of what we do, right? So it's all about touching it with their fingers. It's the sand, it's squishing that finger paints, mashed potatoes, all of that. And it's good for kids to do. What type of play is considered cooperative play? Remember, cooperative play is children, two or more, playing together with a goal. And cooperative play is school age. So it is checkers. There's a goal, okay? It's not sharing, cooperative, a goal in the end. Playing checkers, somebody wins. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning, preschoolers, morals. So morality, Kohlberg, right, wrong, and a consequence, or reward and punishment. Both of things are used when you describe preschoolers. Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? So you have a kid who's going to go in for surgery or maybe an x-ray exam. How would you do that? Because preschoolers, if you teach them, they're happier and they'll do what you want. And using a doll is absolutely appropriate. Good. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? What do you do before you go into a toddler? And then they're going to do what you want. So the first thing is the minimal contact. Get your rapport there. Start playing. Oh, here's a sticker for you. Oh man, I love your sneakers. They light up. They're so cute. That opens that minimal. And then it's play. And it's always least to most intrusive and never, ever head to toe. A 3-year-old child is having an outpatient procedure. How would you help the child to be less fearful? A 3-year-old. So a 3-year-old again, show them a doll, let them they're going to do, show them the equipment, let them touch it, play with them. Kids like to play, they like to know. Before assessing a 4-year-old child, what techniques would you use to approach the child? So you have to do something for that child to gain some sort of rapport with you, right? If they have a Batman shirt on and you tell them he's really cool, and then you pull out a Batman sticker out of your pocket, you're the coolest nurse ever. And they will help you then with doing assessments, especially if you give them another sticker. What technique can be used to examine a toddler? So you've already opened rapport, you're on their level, right? Now what are you going to do? And this is when the fun starts. This is when you start using play as body parts. I would say, so is your heart here? Can I listen to it? And then depending on the age, a kid would chuckle and giggle. Again, you're making it fun. That's why I became a pediatric nurse to play every day. When assessing a healthy child's lymph nodes, what would you expect? If the child's healthy, you feel nothing. If the child has an infection, they're going to be enlarged. Which Erickson stages of developmentals would you use for a toddler? What is a toddler all about? You need to know what these words are because on the exam, they're all there, all different levels, okay? Remember, toddler, automatically me, mine, I want it, I do, but you're telling me no, and you're making me upset, and you're giving me doubt. That's a toddler. What pain scale would you use on a 3.5-year-old child? 3.5, that's right over 3, that goes into faces. You need to know the scales. Multi-select. Erickson's autonomy versus shame and doubt is used to describe toddlers. What does that mean? So, autonomy is what they want to do. They want to do things and try it for themselves. That shame and the doubt is when the parents don't let them try or even attempt to do things. Toddler can play by themselves. That's not what that really means. It means that they want to do it. That's what they're looking for. Me, mine, I do. A 2-year-old boy is playing with mud and dirt. What type of play is this? And that's sense pleasure. Very good. A parent of an 18-month-old boy says that he says no to everything and has rapid mood swings. No, 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 no. And it's absolutely normal. If he wasn't, there's a problem. What is descriptive of the preschooler's understanding of time? Well, the clock says it's 10 after 6. Do they understand that? They understand time, but they understand it with events. When you wake up in the morning, after you eat lunch, when you come in from the playground, this is what they understand, not numbers. What age would most children could understand under, on top of, besides, in, back of, around, over, next to, all of that? And again, I want to tell you, forget you have children when you are looking at developmental ages of children and when you look at your exams. It will be completely different what you think. I would always say 3-year-old from my grandsons, but it is 4. It's a really good thing to remember. Don't think of your children what they did. It has to be what the book says. In terms of language and cognitive development, a 4-year-old child would be expected to. So cognitive development, Piaget, it's all about thinking. What should they be able to think? So a 4-year-old should be able to follow simple commands. Abstract means they don't have to see it, understand it, and they can able to figure it out. That's the adolescent. That's abstract, okay? 4-year-olds, take your shoes, put them by the front door. That's a simple command. What pain scale would you use to assess the pain of a toddler? And it is a Flack scale, right? Ages 1 to 3, Flack. When it turns 3, it becomes faces. A multi. What are the cognitive characteristics of a child, 2 to 7, in the pre-operational stage? Remember, it's thinking now. They're becoming magical and creative, right? So at the ages 2 to 7, they still don't completely understand other people because they don't even know that they have to understand it. They only know what they were brought up, their community, their house, their family. Okay, and the pre-operational is taking the broom and making it into a horse and putting the arms out and being an airplane. That imaginative creativity, that's that thinking, that's Piaget. A 2-year-old has difficulty in activity, sensory sensitivity, and has only speaks one word responses, assessed with a what. Now, I put this out here to tell you that not every place has certain forms, right? And there's ways that we evaluate children that we're saying it's not normal speaking one word responses at 2, and you have to assess them. So what we do is this one we're suspecting autism. So all this is telling you is there are certain checklists, certain assessment forms that are there, and it's just basically finding out which one do I need to use to evaluate the child. What fine motor skills is expected of a 4-year-old child? Fine motor skills. Buttoning a shirt are the only thing with fingers and shoelaces. Shoelaces is at age 6. The other one are gross motor, and that's the walking. This was put here to show you to be careful. Fine motor, gross motor. Look at the words. Make sure you don't mix up them. A multi. What gross motor skills should a 4-year-old be able to do? Gross motor skills, 4-year-old. So gross motor skills is get up and go, go, go. Shoelaces, a fine motor skill. So jumping rope is about age 6, okay? Hop on one foot, walk upstairs, both feet, yes. A multi, which would alert the nurse to hold the digoxin on a toddler she's caring for. And as I said, knowing about what vital signs are will be asked in questions like this. especially like digoxin is the one that they like to use on heart rate. Do you hold it? Or what do you need to do? What's the other part, part of it? So with digoxin, heart rate's too low, dig levels high, potassium level low, those are checked. Pulses have nothing to do with given digoxin. Why are they bounding? I mean, that's nothing to do with digoxin. How can you prevent otitis media in children? Smoke exposure is one of the big ones, okay? Just as simple as secondary smoke. Keep them away. A 4-year-old is reluctant to take medicine. What intervention should a nurse take? One of the things about kids, especially preschoolers, is at home, it's a chore to get medicine down them. It's going to be the same thing in a hospital. So, how are we going to get it done? And how can we teach parents? Well, the one thing is to be a straightforward approach. Okay, what does that mean? Well, if we say, do you want a chewable pill or do you want the liquid? Do you want a spoon or do you want me to squirt it in? Or do you want to squirt it in? That's a straight approach, right? If we put it in the food and they didn't drink it all, do we know how much medicine they took? That's the problem. Unless it's like a little tiny itsy bits, but it's not recommended. Which intervention helps a hospitalized toddler feel a sense of control? Sense of control. And it's all about keeping me on my own routine, right? I know what's coming next. A multi. A child's been admitted with profuse diarrhea for 2 days. What would you expect? Now, I've had a HESI where we had 4 acid-based questions in pediatrics. So I will be putting acid-based questions on these Kahoots occasionally to show you and how to understand acid-based problems. Once I show you, you'll understand a lot better. So diarrhea is all of the digestive enzymes, which are alkaline. So if you're getting rid of all the alkaline in diarrhea, what are you left with? Acid. So you are left with metabolic acidosis. We also know getting rid of a lot of fluid also causes loss of potassium or hypokalemia, okay? If you're vomiting, what would you be in? Well, you have stomach acid. You get rid of all the stomach acid. What are you left with? Metabolic alkalosis. You're going to hear this a few times and you're going to remember by the end of this term. Normal language skills for a 3-year-old child is so a 3-year-old child should be doing about 4-word sentences. Okay, we made it, guys. Thanks for your patience. Oh, we got a P. 3 is a P. 2, Leandra. Good job, Leandra. Number 1, we have a JK. Good job, JK. And a Sarah and a Cam. Good job, Cam. Okay, this is the end of class for today. Know that next week there is a quiz at the beginning. It will be covering the concepts that we're coming off of here. Know that you're getting all your stuff for your exam on Saturday at midnight. So like Friday night, if you want to start studying that, you have it. If you need to be a person with an extra study session, if it's you, a group of multiple of you, whatever you want, I'm willing to meet with you. Just let me know. You guys have a great night and thank you.
Our exam
Thanks.
is on week